I'm the founder and owner of the Hansa Center, and I welcome you to this lunch lecture. I know this is a topic none of you are really interested in. Like, wouldn't it be nice if you could hire an assassin to get into your body and go specifically target specific bacteria, especially the ones of Lyme? So, as far as I know, nobody else on the planet is really talking about what I'm going to talk to you about today. The Hansa Center, if we have a claim to fame, is results, but the next claim to fame would be innovation and creating new ways of doing things. I mean, we don't just keep pounding the same tired treatments over and over again, hoping that you'll get the same results that, say, even last year's patients got. We're constantly innovating, and this is, again, we're very often trying to reverse engineer, if you will, what we're doing to see how it works. So most of you here are patients already. Most of you on the internet obviously may have been a patient and said, and the others obviously are not yet patients. So all this is going to be kind of a little new to you. But so I'm going to start off by just kind of talking about the things that we think we know, and for all of the hallowed halls of science, for all of the marble-lined medical libraries and hospitals, and the little cool electric doors in all the treatment rooms that go bzzz, and makes it all look high-tech. When it comes down to it, yes, knowledge is wisdom, but wisdom is knowing how to apply that knowledge, okay, in newer and better ways. How many of you think that it's wisdom to treat the same old ways that only gets about a third of the people well? And then just lay back and just kind of go, well, it's the best that we know. Is that any good? No, I don't think so either. So again, we're constantly striving to apply the greatest science, not just stop and say, well, I developed Biologix, therefore we don't have to keep developing any other treatments. Or I developed bioresonance scanning, or the guys that are using antibiotics. Well, that's all there is. We're doing the best of science. I mean, I always hate it for doctors that are like oncologists. Can you imagine their world? To look at a newly diagnosed person, who's fit, probably jogged 4 miles a day, looks vibrant and healthy but has cancer, and know you're going to decimate this person in the name of good medicine. And just kind of justify it all by saying, well, it's the best that we got. You're just going to decimate them. They're going to lose their hair. They're going to lose their immune system. They'll never be the same person coming out. And it's the same with Lyme disease. It's the same with hepatitis B and C. It's basically a microbe-centric way of looking at disease. And it's interesting, speaking of cancer, the Surgeon General said that we now know we cannot improve upon the surgical removal of cancer beyond this point. That was in the 1920s. What do you think they knew in the 1920s? They knew that the tumor itself is not the disease. You cut the cancer out. None of you in this room are doctors other than the Hansa doctors. And yet, I think all of you would know if it was easy as cutting the tumor out, cancer really wouldn't be a scary event, would it? You just go get it cut out. You grow a 5-pound tumor, just go have it removed. That was in the 1920s. The Surgeon General of France said, we now know we can't improve upon that. So now we kind of go, I saw it on a billboard, plasma knife surgery for cancer. Well, that's just a sharper scalpel, right? We can now improve our success with cancer because we have plasma knives instead of steel scalpels. Yeah. How many years since 1920? We're coming up on 100 years soon that Surgeon General said that's not good science anymore. And I'm here to tell you it's not good science. I'm not the Surgeon General, but I can definitely tell you it's not good science to keep pounding the body with antibiotics and antimicrobial frequencies from rife machines, and pounding the body with herbal and colloidal silvers and things that bomb the bacteria. I mean, that hasn't been working for a long time. Even for things that are historically were a lot easier to fix. So let's keep going here. Are bacteria truly the cause of diseases? Because this seminar is really not about cancer, it's about the infectious diseases like Lyme disease. So are bacteria really the cause of disease? There are 10 times more bacteria in your body than there are cells in your body. So there's like 150 trillion cells in the human body. Sometimes you hear 100 to 150 trillion cells in the body. So that means there's up to 1.5 quadrillion bacteria. Just bacteria. We're not even talking all the other types of microbes. Now, a lot of people, and doctors included, would look at that and just go, well, yeah, that's all friendly bacteria. Well, that's not what the science shows. The science absolutely doesn't show that it's all nice, friendly bacteria. So what keeps this from creating disease? Because don't we look at strep? If you had strep, how many here, show of hands, how many here, if you had strep, would be kind of concerned you're going to get strep throat or some disease from strep? Seems logical, right? I guarantee you, everyone in this room, according to the research, the latest research, remember wisdom is applying the latest research? Well, the latest research says we all have strep bacteria. If you kept looking, you'd find strep in every single person in here. And yet you may never have strep throat ever again. I can't even remember the last time I had strep throat. The actual disease or any kind of infection from strep. And yet this is a bad guy. I mean, when I was a kid, they were telling our parents, you have to give your children antibiotics, otherwise this could kill your child to have strep, right? Any of you remember that? Come on, some of the guys that have gray hair, you should be able to. Oh yeah, you'd get all these different things from it if you didn't treat. Matter of fact, SRS would even get involved if you didn't allow the doctor to give your child antibiotics for the sore throat and the ear infections from strep. You could have your children taken away. But did it ever occur to you the doctor never went back? He never demanded that you bring your child back to make sure all the strep was gone. And how long did he usually give you the antibiotic? Come on, sing it out.
10 days.
7 to 10 days. Everybody knows that. Kind of interesting, isn't it? Magic pill kills every kind of strep in 7 to 10 days. Not really. You're going to see that later. So, if we're going to say that disease is from bacteria, then we're a walking, talking infectious disease. People have always asked me in my career, am I contagious? Should I not go on my family vacation because I'm contagious? And I'm like, my answer has been standard for years and years and years. You're no more contagious than the rest of us. We're a walking, talking soup. You didn't get sick just because somebody sneezed on you. Is it good to practice good hygiene? Definitely. Keep your fingers out of your mouth and all the other different things. Make sure it's clean. Wash your hands, things like that. Obviously, we want to not just go and throw, exotic strains of stuff into your body. I'm not saying that bacteria can't create problems, but I'm just, again, when it comes time, especially in chronic infections, when it comes time to treat, this knowledge is going to be put forth into wisdom of how to get something better than just bombing bacteria, even with natural substances. So, infectious diseases are tracked by the CDC in Atlanta. Okay? Now I can't even count the number of people that came in with lab tests from other doctors saying, you have a herpes strain virus. The CDC acknowledges, yes, if you test all of us, 92% of us in America, this isn't the whole world, this is in America, 92% of us would test positive to having the antibodies to at least 6 different strains of herpes viruses. Oh my gosh, I can't ever have intercourse again. I have 6 strains of herpes viruses. Well, so does everybody else. Why aren't we all sick with herpes? And you might debatably say, well, I am sick with herpes. And you may be correct, just because your body, though, is what's gone down, not the actual having the bacteria. Does that make sense? Remember there was, in the day of Louis Pasteur, everyone's heard of the Pasteur Institute in Paris probably. His nemesis was Beauchamp, who said, it isn't the bacteria, it's the soil, meaning the body. It's the body. If you treat the body, you can conquer any bacteria. So he said, bring me. He actually challenged Louis Pasteur and said, bring me your most virulent, meaning your most horrible disease-causing tuberculosis strain, and I will drink it, like the test tube. So Louis Pasteur gave him the tuberculosis, he drank it, never got TB. And it's interesting, probably 100 years later, they did a study that showed that only 100 people that get, say, something like the polio virus, only one's ever going to come down with the disease of polio, even in its heyday. So what is shifting to go from one disease to the next in America is not the bugs so much as the human society is changing. We've been pickled, we've been vaccinated, we don't let our bodies fight anything anymore. We're cooler body temperature than we ever have been. You know, like in the old days, they say we were more full-blooded as a race. So we had more infectious, hot diseases. Now we have cold sclerotic diseases because of how we're shifting. Now, the research that was done maybe 100 years after Beauchamp and Pasteur had their tuberculosis study, they took volunteers and they would swallow 100 billion cholera bacteria. That's a pretty bad bug, isn't it? Cholera. Generally you get it fecal-oral, meaning like dirty hands into your mouth or dirty food, dirty water. You know, third world countries fight this quite a bit. If the people were healthy, they could swallow 100 billion cholera bacteria before getting any kind of disease. And yet, if they took a Tums and neutralized the stomach acid, it would take only 50 billion, half as many bacteria, to cause cholera, the disease, to happen. What do we do when we're eating our meals? What do we do? We're secreting HCl. And what do we do as Americans generally? What do we have at the top right of our plate? Water. Water does what to acid? Dilutes it. So you probably heard your grandmother saying, don't drink so much with your meal. Well, guess what? Grandma was right. Because you dilute the acid, it only takes half the number of bacteria of even these seriously disease-causing. You know, with this cholera, it's probably not 1 in 100 people that will come down with the disease. It's probably more like, I don't know, maybe 20 out of 100 or something. But you see, it isn't just a given that just because you go to some foreign country and you have some meal that's laced with cholera bacteria that you're going to come down with a disease. And this is a recurring thing I want you to listen to today, because we're going to be talking about how bacteria are controlled and how we enjoy the success that we do here. Okay? So, population perspective. When it comes to numbers of organisms, humans almost don't exist on the planet. The number of humans versus things like bacteria and other microbes, we are the minority. Even though we have the biggest impact on the planet, maybe, debatably, there are things called bacteriophages. How many of you have heard of bacteriophages? 1. Yeah, they're not talked about a lot out there. Your mainstream medical doctor isn't going to talk too often much about this. Your Lyme literate MD isn't going to talk a lot about this because his focus is somewhere completely different. He's focused on killing bacteria for your body, which, as most of you would say, hasn't worked too good for the majority of people in the long run. Bacteriophages are viruses that infect different bacteria. And it's fascinating because they are the assassins of the world. Literally, bacteriophages, there's so many of them that if they were the size of ladybugs, they would completely cover the planet and be several miles deep. They reduce the population of bacteria by half every single day. So imagine the bacteria are replicating rapidly, right? To be able to survive, half the population of bacteria on the planet are being killed by bacteriophages every day. Every day. So, yes, ma'am?
Are they fed by HCl?
No, I don't think so. So let's keep going, though. Let's see. So this is a picture of actual bacteriophages. Pretty amazing that these things exist, but they attach to the bacteria and destroy them selectively. And bacteriophages are debatably your best ally when it comes to killing any kind of bacteria that are out of control in the body. And that's the key. It's not just any bacteria. We wouldn't live if bacteriophages just killed everything. What if they killed half the bacteria in our body every day? I mean, we need those bacteria. We are those walking, talking infections by that definition, right? We have those. There's 10 times more of them than us. We just don't want any of it to get out of control and overpopulate. And that's what you're going to see these assassins of bacteriophages can do. Now the printing on this is quite small, so I'm going to read it off to you. The specific interaction of a bacteria and its host bacteria lends itself to seeking out bacteria, in particular pathological or pathogenic bacteria within humans. Isn't it shocking you've never heard of this? Right? One person's heard of it. Bacteriophages specifically recognize and bind to their host, such as the Lyme spirochetes. Strategically go to the ones that are the bad guys. Sounds like a pretty good hired assassin to me. Bacteriophages appear to exert significant selective pressure over bacterial populations while still, and I love this, while maintaining bacterial diversity. And right here I put in quotes, such as killing the winner. Now you might kind of be like going, why would they kill the winner? Well, let's say the whole variety, the whole species of bacteria in the human body. Let's say there's lots and lots and lots, gazillions of, since that's a wonderful medical number, gazillions of friendly bacteria types. They can, let's say that Lyme was your number one, and it started really doing some bad things above and beyond all the other types of bacteria. So it's the winner of the who can populate and create the most havoc award, right? Those are the ones that bacteriophages target specifically. So if strep were to suddenly be the winner, meaning it's actually outgrowing everything else and creating chaos in the whole human body, boom, you're at the top of the list. Bacteriophages are now going to go after you in the way of that strep. So emerging data suggests that bacteriophages could play roles in regulating the immune reactions in the body. Not just going out and killing, but actually helping to coordinate your own immune system to do what it was designed to do. These guys are totally awesome in the way of hired killers, aren't they? Not only are they going to go out and do it themselves, they're actually going to help elicit your team to go out and kill them too. Your immune system. So, frequency-matched remedies encode bacteriophages to seek out specific bacteria. I think that is possibly how Biologix and Lymogen and when we compound specific remedies for each person, because we know there's nothing antimicrobial inside our formulas, we know we're not physically bombing bacteria. So you can't look at it and just go, well, this works because it's killing bacteria. No, you have to look at it differently. When I developed my formulas like Biologix, it wasn't what do I need to kill the bacteria with? It was like, if the body had Lyme as its most worst thing, and all the co-infections, the L forms, the, if you want to call it cyst forms of Lyme, and all the different viruses associated with somebody that have Lyme, if your body had all that, what frequencies would you need to encode the body's responses to selectively kill the Lyme? Now we know the immune system isn't really what's doing it because you never see the white blood cell count go up. Okay, if you had severe strep throat, doesn't your white blood cell count go up? And your doctor goes, there's no argument. Yes, you have an infection. Other things go up as your immune system fights. So with the research that I did on Biologix, we were using something called a Lyme urine antigen test. This is a urine test where it's just like normally your MD would give you antibiotics for a week to try to increase the die-off of bacteria, of Lyme, so that the lab could capture and see in the urine, after a week of taking antibiotics, some dead pieces of Lyme bacteria. So back in those days with the Lyme urine antigen test, a positive test would be 32, a score of 32, which meant 32 pieces of Lyme bacteria that were released in the urine, at least one of 3 days' urine. It could be 0 the first day, 32 the second day, and 0 the third day's urine, because it wasn't a uniform die-off. As long as you had 1 day that was positive. A highly positive was reported as a 45, meaning 45 pieces of dead Lyme bacteria showing up in your urine. And that's after antibiotics. So after 1 week of taking 1 dropper 3 times a day of Biologix, that's a pretty low dose. I mean, a lot of the time our docs start you out at like maybe 3 droppers 3 times a day, but we were just doing a standard 1 dropper 3 times a day on people that didn't know they possibly even have Lyme. And after that 1 week, did the LUAT test, and almost every single person, something like 60 people, I believe, at that time that we ran through this study, were between 100 to the point to where the lab quits counting, which is greater than 400. Now, how do we kill that much when antibiotics barely can get even 45? When I presented this research at the 1999 International Tick-Borne Diseases Conference in New York City, I had MDs that came up to me just incredulous saying, I've given the most aggressive antibiotic cocktails and I've only seen 1 patient score 100. How are you getting these numbers? Well, again, if you don't know what we're doing, it's hard for the doctors to want to use the remedies. And as far as I know, this is the only true lab proof that a natural product is doing anything in this regard. And again, being a natural product, we cannot make any treatment claims. That little statement you see on your bottles and on marketing, it says, these statements have not been approved by the FDA, and this remedy is not intended to treat, cure, mitigate, or do anything for anything. All you can say is structure and treatment claims. So to present this research, I stated it as strongly as I could. I said, novel botanical formula, so I had to come up with a title, with antigen-releasing factors, which is kind of code, meaning if you understood the antigens are the dead pieces of Lyme bacteria. Pretty cool way to say it, right? Of course, in the 90s, even that lab wouldn't let me mention their lab in the research, even though we sent Biologix to the lab to be tested in control urine. That means clean urine that doesn't have Lyme in it, to see if it caused a false positive, and it doesn't. So we did everything we could do. We sent it to Toxicon in Bedford, Massachusetts, which tests pharmaceuticals for toxicity. So they tested our product, Biologix, for toxicity and found it to be so non-toxic that we didn't have to go on with further testing because no one's going to drink a gallon of it trying to OD on it. And plus it wasn't going to work. You could take 150 times the maximum recommended dosage, the adult dosage, and still have no toxic effects on male and female rats, and so it's animal studies, but still. Anyway, it's very possible, since we look at the remedies and say there's nothing in it that's boosting the immune system, there's nothing in it that's specifically killing bacteria. This is why herbologists don't like my formulas. They look at their remedy selection and go, that shouldn't work. Next. And they'll just discount it out of hand. So the most influential botanical medicine guys, they don't like them because they don't like the ingredients. They want to be able to look up the ingredients and see that this kills bugs, okay? But this is that, again, getting to where knowledge is not a static thing. One of my favorite quotes is one that says something like, in times of change, the learners will inherit the earth, while the learned will be beautifully prepared to deal with a world that no longer exists. And that's kind of what's going on. I mean, the microbial community of the world is getting more and more complex as things are mutating. Bacteria, did you realize there's no such thing almost anymore as standard strep and staph and all these other things. They're mutating. So you can't, if you got a learned degree in the hallowed halls of medicine, 20 years ago, you might look at that doc and go, wow, he's been out for 20, 30 years? He must know a lot. You may be beautifully prepared to deal with a world that doesn't exist anymore. The world of antibiotics, which isn't working anymore, as we're going to continue to see. So my theory is it's very possible that the remedies that we compound here dynamically for your body using the bioresonance scanning, or maybe the formulas I've developed, are actually frequency matched to work like software that programs the bacteriophages to strategically and specifically address whatever bacteria we told them to go after with the remedy. How cool is that? I love it. Okay, so AMA, what do they say about all this? In the Journal of the American Medical Association, they said that please, they're begging their doctors to quit treating every little infection with antibiotics. Because guess what? Like I said earlier, they found out that all they're doing is creating mutated superbugs in these children and adults and things that now they can't use any antibiotic. And these are the easy bacteria. These are the ones that were easy, 50 years ago to deal with. What do you think Lyme's doing in response to bacteria? Do you think they're getting annihilated? No, they're getting mutated, just like the strep and everything else. So it's time to update the knowledge and create some real treatment wisdom in how to handle these infections. So they're begging in the Journal of the American Medical Association. I shouldn't say begging, that's a little harsh, but they're asking their doctors to stop giving patients antibiotics for every little thing, which makes who angry? Who does that make angry? Parents. Parents. How many of you have a friend that just like goes, oh, I have such a sore throat? This is one of my favorite. I've seen it so many times. I have such a sore throat. I need an antibiotic. And they toss it down, and within 30 seconds they go, oh, I feel so much better. I mean, goodness, it hadn't even started to dissolve yet, and they're already claiming that they feel better. I'm like, really? There's no painkiller in antibiotic. There's no, the membranes that were all inflamed in your throat, they're still inflamed. I was like, really? Come on now. And that's kind of what they're saying, because they said, do nothing. And guess how long the infections it takes it to go away? Do nothing. 7 to 10 days. So all those years they were claiming cure because of the antibiotic. It wasn't the antibiotic that was getting them well, the little kids well. 7 to 10 days, it's all over anyway. Okay? So a lot of people would just go, well, my child did not make that up. I was like, listen, the research is what it is. That I'm not saying they made it up, but why they got well was maybe not the antibiotic like everyone thought. If you get your arm cut off in an accident, dude, yeah. Use some aggressive treatment like that, maybe. You get a tooth removed and it's already kind of infected and stuff like that, yeah, you might want to opt for a short run of antibiotics. I don't know. That's a personal judgment call. I've done it myself when I had to have stuff done. Because again, I don't want gangrene to come back. I don't want certain things. It isn't that things cannot cause disease. But you just don't, you'd want to stop and pause for just a second and kind of say, wow, is this really what I want to be doing? Now, obviously, I'm a doctor. I know how to handle everything that comes along, but still there's times where I'd still opt for mainstream medicine on the short run to keep things from getting out of control, maybe. But even then, that's probably, there's just as many times, if not more, that I'd never, ever, ever want to take a pharmaceutical, and I don't need to, and the patients we see. Saw a lady with 104.5 fever the other day, and just did what we do. Severe pneumonia, and she was completely well by the next morning. It was pretty amazing. So, let's keep going. Well, what about rife machines and antibiotics, herbs, colloidal silvers, mild silver proteins, anything you want to call it? These are bombs. These are things that are actually supposed to kill the bugs for your body. Would you rather have some frequency that's like, let's say rife? I'm not opposed to it. We use those type technologies here for different purposes. But it's like a phone number. You're only as good as the best numbers you know to put into your phone, right? So once you've run the frequencies that are supposed to be for Lyme and you're still sick, what are you going to do then? You got to find different phone numbers to plug into your Rife machine, don't you? Can it help bring down the numbers? Sure. I'd rather have these assassins really go full force and work with your body to keep these things gone, okay? So, antibiotics, think about the word. Anti-life. Bios, life. Biology, the study of life. Antibiotics means anti-life. Why would it? I mean, it's a very good word because, again, what did we say we're mostly made out of? Bacteria. 10 times more of them than there are of our own cells. So it is anti our life to actually throw these bombs. It worked for a while, and it can work in certain situations of life-threatening situations, but is it where we want to go just for things that are chronic, like Lyme disease? It's not working in the long run. So we are that microbial soup. You know, the best antibiotic in the world, they say, will only kill 85% of any of the target bacteria. 85%. That's with cocktails of antibiotics. Dr. Lyda Matman, who's a Nobel laureate, was a good friend of mine out of Wayne State. She's written, at least 2 different textbooks on infectious diseases. They're called stealth pathogens that she studied. And she found that in everybody's blood, she and Joanne Whitaker also, who owned a Lyme-specific lab that could actually cultivate and culture the Lyme bacteria. They said nobody's blood, no matter what regimen they were using, whether they were using years of Rife to get well and no longer had symptoms, used antibiotics to get well, and no longer had symptoms, used my stuff, and everybody else's system of treatment, they've never seen anybody's blood completely clear of bacteria, of the Lyme bacteria, and the cyst forms of Lyme. And the cyst form can go back to the spirochete form to escape. And there's other shapes that it can actually take on, the Lyme bacteria, to avoid dying off. But does it need to? Or does it just need to be the one that's the highest so that we can send the assassins after it? That's why we enjoy a greater success here. And you know what? Once your body knows how to do this, what happens if you get bitten by another Lyme-laden tick? Do you just come down with Lyme disease again? No. Your body already knows how to deal with it. As long as you maintain optimum health as best as you can, that's why we don't use toxic chemicals in our homes. That's why we do natural medicines. That's why we stay checked out periodically with the doctors. We'd want you to stay as healthy as possible, right? Before you have disease. Because again, it's almost like the whole stomach acid thing. If your body's working correctly and the stomach acid is nice and high because you didn't drink anything with your meal, except maybe a few sips of whatever you're drinking, but not a whole ton, your stomach acid keeps you healthy. Nothing can hardly survive that. So they say that when a child takes their first antibiotic, it kills over 400 strains of friendly bacteria. Our best acidophilus probiotic type products can only supplement, again, maybe a dozen. So again, you want to think twice before you go subjecting your children to this, even if they have Lyme disease. Does it change because it's your child? Well, your intensity, I guarantee you, parents are more hyper-vigilant about their children than they are about their own body, right? So what are they going to do? We got to have antibiotics. It's my child, and I get it. But I hope you see that when it comes time to treat, the long-term antibiotics on that child's body is going to just create damage and wreak havoc, and it's not even going to work in the long run. Almost every single time. Okay, symptoms. 88% of every medicine in use is treating only to suppress the symptoms. This number steadily goes up. You would think for all of the white jackets and stethoscopes around their necks, and all the medical libraries and all the research and all the trillions of dollars that have been poured into all the different medical research organizations, that they be treating cause at some point. This number is just going up. All they're looking for now are lifetime medicines. That means they want you using for the rest of your life. How many people know somebody that's on high blood pressure medicine? Let's just pick that one. Everybody, right? Does the doctor ever say, hey, get on that, after 3 months you should be able to get off again? No. If it was something about health and healing, they wouldn't do it that way, would they? I kind of use the analogy of a rancher. And he knows he should have 12 years life in his cows, let's say. And the whole herd of cows that he's running gets an infection. And he calls the vet, and the vet gives them all the medicine, makes it all go away, but they all die in 5 years. Is that a great woohoo? That's kind of what it is. It's like allowing yourself to die still, but you don't feel it. If all you're going to do is treat the symptoms, you can have a great life while you got it, but the cause is never addressed, and therefore it keeps running and getting worse, doesn't it? Unless your body can finally pull out of it by itself, it's going to just keep getting worse to treat the symptom. That's why you eventually have to get on a stronger medicine. If bacteria are not the ultimate cause, though, then they too are a symptom. How about that? A symptom of what? Imbalances in the body, because when the body is working correctly, in an ideal scenario where the body is working correctly, the bacteriophages would go after what? The one type of bacteria that are raising their head above everybody else. Do nothing. That's the way the human body was designed. So everything that our doctors are doing here, and so many people come here and want to hear us say these words. Are you killing the bacteria? Yes, I am killing the bacteria. But instead, we're not going to say that because we're not a Lyme treatment center. Oh, gosh, they hate to hear us say that because that's why they came, right? We have people that have Lyme. We have people that have all these other exotic illnesses. But our specialty is how do we restore what's optimum so that your body and the bacteriophages, we don't just kind of go, oh, raise the body and create balance and everything will come back as roses. No, we're specifically, strategically, frequency matching the formulations that we've compounded for you in the treatment room to specifically target certain things that we found on our testing so that the body, meaning like everything that really means, the immune system, the lymphatic system, every other system, including the bacteriophages, can then now more specifically and strategically go kill those guys for you permanently. And health follows speedily. So true healing cannot occur if at every turn we are blocking what the body is trying to achieve. This is true wisdom. It's not saying, body, step aside, I'll give you this drug that can do it for you. It's saying, what is the body trying to do? If you had allergies, where is the body messed up and what's it trying to achieve with that? Wow, I didn't think the body could be trying to achieve something with an allergic reaction. Maybe it is chaotic and it's out of control. Same with its ability to regulate infections. Maybe it is chaotic and out of control. But how do we restore that control? We don't restore it by, bombing these microbes and taking antihistamines. So, Lyme disease. The truth is that no virus, no bacteria can replicate out of control and cause disease in an optimally healthy person of any age. I hear the contrary to this almost every single week at least, where somebody says, oh, but I was healthy until I got bitten. I was jogging 100,000 miles a week. I was eating organic. I've always eaten organic. I've always gone to chiropractors. I've always done all this. I was healthy. No, you were symptom-free. There isn't one of us that's optimal around here, not even our doctors, because unfortunately we treat everybody else more than we treat ourselves, right, docs? But we do get treated. Asymptomatic is a fun place to be, isn't it? You feel good. That's no guarantee that everything underneath isn't chaotic any more than the person that jogged 100,000 miles a week who their doctor suddenly found a tumor in. They didn't suddenly have cancer. By the time you can feel it, it's already been going for what? 7 to 10 years. You weren't healthy. You were asymptomatic. So becoming optimally healthy, even as a child, we're not all born equal, right? This whole equality thing, and no, we're not all born equal. I'm vertically challenged. Hit my head on everything that's Okay? I'm not equal, right? So it's at the same time, we have to understand that concept of like, in an optimally functioning body. So who doesn't need to be treated like we treat here? Everyone needs to be treated here. We can help every condition that walks in the door. Can we fix everything? Nah, not yet. I'm not God. I don't know, Dr. Stride, are you God yet? No. Dr. Cox, are we God? We can't fix everything in spite of our best tests. But the philosophy remains the same. How am I going to keep doing it? Would you just go, oh, well, that's a screwed up philosophy because they couldn't get me well? No, because you know what? Our docs, if you give us the opportunity, we're going to try to figure it daggum out, aren't we? We're just not going to roll over and say, well, we used some natural remedies on you. We used antibiotics on you, and you didn't get well. It must be in your head. You're making this up. No. Never. I don't think I've ever seen anybody. I'm trying to think in my database, in my brain. I don't think I've ever met anybody that was just the hypochondriac that was saying, nothing's wrong. I mean, everything's wrong, but really I'm saying, no, it's all in your head. That's what these people are being told, though. Tons of them are being told they need a psychiatrist more than a doctor. Complete annihilation of the harmful bacteria is not what creates the restoration of optimum health. But that's what we're being told, isn't it? If I could kill these bacteria, these Lyme bacteria, then I will be well. But I guarantee you, if we could irradiate the human body like they are meat, you know, they're radiating meat so it doesn't have to be refrigerated. If I could radiate the body, would health just come on speedily? Even if I could just radiate the Lyme bacteria, is that what creates health once you've lost it? That's not what the research shows. Okay? That's why we're doing 2 weeks of intensive right off the start. That's why we ask you to understand and be realistic that even a blister is going to take 4 to 6 weeks to heal. So we encourage you to stay realistic about how long it's going to take to get well. You know, that 2 weeks that we ask for at the front end, that's not, you know, sometimes people come and they do 2 weeks and go, wow, that didn't work. I'm like, really? You can't even go to the gym and work out for 2 weeks and see any difference. Okay? It's an ongoing process. I'm sorry, but it really is sometimes. Do people get well, magnificently well in 2 weeks sometimes? Yeah. I mean, we see some pretty dramatic stuff happen here. But the reality is, if you get a blister, just that, something simple, it's still going to take 4 to 6 weeks for the skin to completely heal so that you can't tell where that blister was. That's saying you don't pick at the scab once it turns into a scab. And that's saying you don't put those shoes on again that created the blister. Let's say it's on your foot, right? And then get infected. Then it's going to take what? Longer, isn't it? Well, that's kind of how it is. We hit it a lick. And then we hit it a lick. And then we hit it a lick again. Until you have the restoration of health that you've been looking for. And if we can't do it here, guess what? That tells us, I mean, because of the sheer magnitude of what we can do for people under this one roof, it's got to be something pretty big blocking your healing. And that's when we start trying to send you maybe somewhere else for a targeted thing. Say, okay, well, wow, we can learn a lot by what isn't working here. And then we can strategically help you get to where you can get that eliminated. But then guess what? We're going to want you to come back because no one else can do what we're doing at this point because we've innovated so far beyond what most other clinics are even considering anymore. So, this is a saying I've been saying for about the last 10 years. Treat the human condition and health will follow. Treat the bugs and more bugs will follow. And you can see why that is now, hopefully. You can start seeing the wisdom in what it is that we're doing here. So, I'm so delighted you came. I hope you've learned a lot. And hopefully you understand now how that assassins can be targeted, and those are those bacteriophages, to go after whatever. It's kind of a beautiful way of doing it because guess what? Bacteriophages aren't going to kill off your good bacteria like the antibiotics will. They're not going to cause yeast infections as a side effect. They're not going to cause anything as a side effect. You know, but we see huge amounts of the Lyme bacteria dying off. And you would think the whole world would come running, flocking to do this. But it isn't just Biologix. It isn't just about some one remedy that you can buy over the internet and get well. Woohoo, I got Biologix, I took a bottle, nothing happened. I remember when I first developed it almost 20 years ago, that's what people would say. I took a bottle and nothing happened. I took 3 bottles and nothing happened. That's why I wrote a book. I've written 4 books on Lyme disease now. I was the first one to ever write a book on the natural treatment of Lyme disease. I was the first one to develop a product specifically, strategically, frequency matched. I'm the first one to have research to show anything, and I may still be the only one that doesn't just say, hey, we gave so many people this remedy and X number of them felt better. Feeling better is not research. It's great, but lab research, I think we're still the only one that have that. Okay? But I don't have to write a book of 500 pages if all I'm going to tell you is take a bottle of Biologix and call me in the morning. Okay? That's why we do everything that we do here. Sometimes you may be sitting on a therapy or something kind of going, I don't know if this is doing anything. Everything we do here is strategically designed to do a function to restore what's optimum, even the things that you don't know are suboptimal. So anyway, I hope this has been educational to you, and let's walk in wisdom. Y'all have a good day.